Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, today we're diving into a fascinating and often overlooked corner of our profession, and that is musculoskeletal therapy for exotic and non-domestic species. I'm joined by Juniper Connal, and she brings a wealth of experience working with some truly unique patients, so from hedgehogs, sugar gliders to turkeys, reptiles, and iguanas. So whether you treat exotics regularly or only occasionally get that mystery patient through the door, this episode will open your eyes to what's possible beyond the dogs and horses that we usually see. If you're not a member already of our amazing online community of vet rehabbers from all over the world, we gather in our Facebook groups. So if you haven't joined, you can head over to Facebook and request to be part of the action. Our groups include small animal vet rehabbers, equine vet rehabbers, hydro vet rehabbers, and our business vet rehabbers. That's for those of you that are juggling patient care and running your own practices. So we regularly share tips, advice, and host live sessions with experts to support you on your vet rehab journey. A quick word from our sponsor before we dive into today's topic. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands Walking Pets, Help 'em Up, Respond Animal Therapeutics, FitPaws, Muffins Halo, Sleepy Pod, and Canine Cots offer effective, innovative, and proven solutions. You can sign up today to receive a one-time special gift for all our Onlinepethealth listeners with your next order, and just head over to pawprosper.com/OPH. All right, over to my chat with Juniper. Hey Juniper, thanks so much for joining me.
Hi, thanks for having me.
Juniper, why don't you tell the listeners a little bit about yourself and how you got into the field of vet rehab?
So I'm a vet physio in the UK, based down in the southwest. I originally studied equine science a very long time ago because I'm quite old, and then went into the NHS and worked in public health. But whilst I was doing that, I became very involved with fostering dogs for a local, or for a rescue called Many Tears Animal Rescue. And I saw some very damaged dogs that had come out of breeding farms. And I was amazed by how well they could recover and become pet dogs, having spent the first 6 years of their life in a kennel being used for breeding. At the same time, I had my own horses, competed them, and I started thinking my career in the NHS wasn't fulfilling what I wanted. I was earning money to pay for my dogs and my horses, and an opportunity came up, so I went back to university, retrained as a vet physio, and I've been running my own business for about 8 years now, predominantly horses and dogs. Absolutely love it. Earn far less money, but I'm actually doing a vocation now. You know, they say, don't they, if you do a job that you love, you'll never feel like you have to work a day in your life. And that's where I am now. So much happier, and really glad I made the transition.
That's awesome. And you have a little bit of a passion for treating exotic animals too, right?
Yes. So through my equine work, I became very involved with a local agricultural college, Bicton College, and I knew that they had small animals and exotics, and I happened to mention in passing to one of the staff that I would really quite like to get involved. And of course, with that, they went, "Oh, yes, please do." And I had my first experience of working with exotics. Went down to the zoo, saw animals that I can't even pronounce their names.
Yeah.
and realized what a massive gap there is in that area and how much these animals would really benefit from having musculoskeletal work and rehab.
So what was the first exotic that you treated?
Oh, it's a fabulous story. So, Kevin, I get introduced to an iguana who is about 3 foot long, maybe a bit longer. And
Wow.
Kevin had been at the college. Now, this college tends to take a lot of rescuing. So these animals tend to be dumped there, and there isn't a massive history. He was sexed as being Kevin. And then after a few years, Kevin laid an egg. So Kevin became Kevin. I think that's how they pronounce it. We all still call her Kevin. And she laid an egg, and then she became very unwell. And the thing with reptiles is they can go without eating for months, and it might be normal, but it could also be a sign that they're very poorly. And we tend to not notice until they reach that critical point that they're not going to survive. Kevin was scanned, ultrasounded, and they found she had egg bind. So they then did some surgery on her. She was neutered. First time I knew you could neuter an iguana at that point. Um, Again, they don't cope overly well with surgical procedures, and she became very unwell with gout. So I'm now having a crash course in the fact that a lizard can be neutered, can be missexed, and by the way, it can also suffer from gout, which isn't something that I've come across within my horse, dog, and cat field very much. And it had reached the stage where they were discussing whether euthanasia was the next step because Kevin was very unwell. She hadn't eaten, she wasn't moving. And they literally said, anything you can suggest, we're very keen to try. The vet was very keen to support this. And I went away and did some research and discovered there was very little, if none. I went back and I was incredibly honest and said, look, I don't know whether therapeutic ultrasound will help, but you're telling me that Kevin's happy to sit in a water bath. I'm happy to try and treat her feet, which is where she had the worst of the gout. Let's see what happens. So she was currently taking opiates and antibiotics. The other thing about pain relief and other medications is it can take about 18 times longer to work in these animals. So when you give them pain relief, they're not going to feel better very quickly. So we used some therapeutic ultrasound using a water bath. And again, I can look at a dog and tell you when that dog is more comfortable, or I can look at a horse and go, that horse looks better. I'm not so good at reading a lizard. Amazing handlers who did know her, and they were saying things to me like, oh, look, her breathing's changing. She's looking better. She's managing to move. So I did a bit more research into gout about the fact that mild to moderate exercise can help. So I went back to them and I said, we need to make this lizard walk. How are we going to make her move? We initially tried swimming her because she loved water. And my intention was to make the water bath that they were using for pain management a little bit deeper, support her, and see if she just moved her legs, if we got that automatic movement that we quite often see when we swim dogs. It didn't work. She kept putting her head under the water and said, I've had enough. So they, again, you have to work with really good people. The team at the college took her out the water and said, this isn't going to work. But because I'd given them the information about how we wanted her to move a little bit, one of the caregivers popped her on the ground and went to pick her up, and she took 2 steps forward. So they went to pick her up again and took 2 steps forward. And every day they would bring her out and get her to walk a few more steps. Next thing I know is I'm getting a phone call to say she's eaten. For the first time in weeks and weeks and weeks, she's eaten. And it was a long process, but we saw these little glimmers and she started improving. And she's gone from being in a very small enclosure, flat, make sure she can't hurt herself, to I saw her enclosure last week and she's in one that's about 7 foot high. She can climb everywhere. She gets in and out the water. Her colours change. She's gone from being an orangey grey, very depressed looking lizard to a vibrant green And I'm like, this is phenomenal. We've done something here. For a lizard that literally they were talking about having to have her put to sleep. So that was my first one. After that, they started throwing everything at me, going, "Oh, could you help this one? Can you do this?" But that was our first one. And I'm not going to ever forget my Kevin.
Yeah, that's such an amazing story. And like what really came through was, how we rely on behavior of animals to read them. And as you were saying that, I was thinking, like you're right. Like how do you know, like because we're not used to the behavior of a lizard or a rabbit, I think we can do a little bit because a rabbit can be similar to like a small animal, but maybe you can share some differences. But I'm just thinking about all the different types of exotics, whether it be a snake or a hedgehog or something like that. Like what's normal? What isn't normal? Like what's a sign that they're in pain or what's a sign that they're in discomfort? Besides biting you, like those subtle things that we look at in dogs and horses, just it might be just a movement of their ears or body posture or their eyes or their nostrils or breathing and things like that. Like, how easy is it to see all of that? And is that the same in our exotics? So that was something that I like really shone through when you were speaking. I was thinking, it's not something that even in vet school we were taught about. And to be honest, I mean, I don't remember. We had a small course on fish and birds, and being in South Africa, we had a larger course actually on wildlife. So we had quite a lot of training in wildlife, but I don't recall, unless I was like sleeping in that class, but I don't remember like learning anything about iguanas or lizards or snakes or anything else besides a fish or a bird. So, for a lot of us, it's something completely new, treating an exotic. And I think one of the problems is that because we don't also treat them often, so like for most of us, we'll have a small animal practice, and then every now and again, something exotic will come through the door. And I have this memory of when I had my practice, and I remember just cursing my receptionist for not telling me. But I was seeing dogs and cats, and somebody came in with this cat basket, and I opened up the cat basket to see like what have I got here, and I could feel it was really light. So I actually thought it was a kitten, and I had like the name of the patient, and the name of the owner was the first client, first patient, and the history and everything was there. But I was going to go through that with the owner, and I open it, it's a hedgehog, and I'm like, oh my gosh, how am I going to do anything on a hedgehog? Like the only thing that I can get to are its little legs. And thankfully that's what it came for. So it had like a strain of its one leg, and I had to make it came from a referral from a vet to make a small little brace. So a soft sort of neoprene type brace just to support its leg. So I was relieved that that was what I had to treat because that was the only thing I could access.
So I had a hedgehog quite recently who had become I was really struggling with both back legs. The mobility was exceptionally poor, and I went down the route of pain management. So we used the pulse mag just to see if we could help. It was an elderly hedgehog. She'd been handed in quite recently, but she'd very quickly lost this mobility. And very sadly, the decision was made that she couldn't continue, and she was put to sleep. It was only at that point that I was told about the fact that quite often they can suffer renal problems. And it's really common in these small exotic mammals that when they suffer renal problems, the way it presents is with hind limb paralysis.
Oh wow, that's
So
interesting.
it wasn't, we probably did help a little bit with some discomfort, but that's the other thing is not necessarily knowing all the ins and outs, but being prepared to go, well, okay, we'll try this. So it's not that what I did was wrong. Nobody could have helped this little hedgehog. But yes, there are some really unusual anomalies between the animals, and we don't have agreement. So pain scoring in exotics is one of the most under researched and difficult to understand areas. Mice are the only ones that we have a really good pain score for because they've been used so much in labs. Even in rabbits, there was a pain score, but it was designed for little white rabbits with red eyes that are used in experiments. And that's not what's going to walk through the door. A lop-eared rabbit, a giant rabbit, a dwarf rabbit is not going to be the same as your rabbit. And that's why pain scoring is so difficult to do. And the only way you can work with exotics is to have a handler that knows what they're doing.
Mm.
But the majority, or that's possibly a lot of problems that we see in exotics, is due to the owner or the handler not being aware of how to keep them well. So
Yeah.
I'm very lucky. I have a team of experts, literally world-class experts. But your average family who have bought an 8-year-old and a gecko, they could come for discomfort, pain, mobility issues, and actually it's because they're not been feeding it the right thing. They haven't been getting enough calcium in their diet.
And I think if you think about our small animals, I mean, we rely so much on the relationship between the pet and the owner. We rely so much on the feedback from them, history from them. And I mean, never having had an exotic of my own. So I've never, and my kids have never had one. I've never had one. So I might be incorrect here, but my feeling is that, you don't build the same type of relationship. They have a relationship, but it's very different to a dog, cat, pet owner. Am I correct in saying that?
I don't really know. I don't think so. I've got a local guy who has a lot of reptiles, and he manages his reptiles by consensual relationships. So he puts his hand in, and if the lizard or snake doesn't move towards him, he doesn't handle it that day. So, in the same way that we're seeing people doing this with dogs, where you've got where you're waiting for the dog to consent to certain activities and not imposing yourself on them, there are people with reptiles doing exactly the same thing.
Yeah.
Um, we've got I say we, sorry, at the college there is a large snake called Rodney. Rodney is 14-foot python. He lives in a room that's behind thickened glass doors. And if Rodney decides Rodney's coming out, you need about 3 members of staff to be able to shut the door to stop him. Once a year, the person who used to own him comes to visit him. Now, the guy who used to own him used to use him for pettings, take him into schools for people to meet, and he just got so big it was not practical anymore. So he spoke to the college, and the college agreed to give Rodney a home for life. Every year, his owner comes once a year. Rodney knows that owner. Rodney reacts to
Really?
him. He comes up against the glass. He says hello to him. If you didn't see it, you wouldn't believe it.
Yeah.
I've also treated a water dragon, and it was quite noticeable when you found the right area how much happier she was. She's not going to wag her tail at you or climb up on you. But if you treat cats, cats aren't always the most responsive to turn around and say, oh, yes, that's perfect. And I've certainly done quite a few stoical horses that will stand there and go, I'm ignoring you, I'm ignoring you. And then you step back and you go, oh, there you go. They look a lot better now. You can see the release. It's the same. You just have to trust your judgment. And yes, these animals can have quite amazing relationships with their owners or caregivers.
Yeah. I mean, having treated a few exotics, the people that brought them in, they weren't really part of the family. When I say that, it was, they were in a cage and they handled them every now and again. And so in those cases, it really makes it tricky. And so, I mean, I think in your situation, it's great that you're at the college and you've got really, really good handlers. They know the animals really well. It's tricky when we are treating small animals, dogs and cats, when we have an owner that doesn't know. You know
Mm.
how it is when somebody else brings the dog in. You sort of feel like I haven't really got the whole picture here. You need to speak to that owner. So it's really important, I think, that we try and use communication skills with these exotic owners to try and get whatever information that we can. What are some of the unique challenges, like, let's go through them that therapists face when they're treating exotics?
Um, I think less is more. So if someone is paying me to treat their animal, I feel that there's a set amount of time that I would normally give over, um, and I would expect to see certain milestones along the way of the journey. If you go and treat an exotic, I'm probably only going to get hands-on for a few minutes at most. There might be some observation time, or there will definitely be observation time, and then I can't offer the same fairly certain milestones that I can in the rest of my practice. So if we go back to something like the iguana, Kevin, I didn't know how fast she would improve or how successful it would be. But then we treated a water dragon called Athena, and she suffered from metabolic bone disease, MBD, which is really common, sadly, in reptiles. And again, pain relief would have taken weeks to start working, and she just copes with the pain. We did a little bit of trigger point release on her, and instantly you could see the tissue release, and you could see her breathing changed, the rate of blinking changed, and we'd caused an instant success. But until I put my hands on her and tried, I wouldn't have known that. So with exotics, you've got the fact you're going to be very brief if you're going to do any hands-on, and then actually you don't know what that's going to work. If I put my hands on a dog, I know I'm probably going to make that dog feel a bit better. Might not do everything I want to, might have to adapt my treatment plan, but I'm confident. I'm not confident when I start treating an exotic like the hedgehog if I'm going to make a difference. So I'm coming at it very much in a do no harm approach, um, and then hoping that we get a good result from it. But I'm surprised we very often do have good results.
And then obviously, of course, we're seeing such a small percentage of our patients that are exotics. So if you were seeing just exotics all day, 15, 16 a day, then, you'd be in a position where you'd be like, I've seen this before. This is how they've reacted. This is the response that I've got. And then you'd be in a better position to be able to know whether your treatment's going to work or not.
Maybe, but there are so many exotics out there. You could literally just see exotics and nothing else, and still something would come in that was different.
Yeah.
Um, we did a sugar glider. I treated a sugar glider last year. It's a very small, almost sort of hamster chinchilla sized animal. And its whole side of its face was on one side, it was all screwed up. Its ear was curled in on itself. It had some dental issues. We did some very gentle massage, and we are talking a few seconds. And I can't remember if we used the pulse mag with that one as well. But having treated it and popped it back, I saw it again recently. So a few months later, its entire side of its face has now looked normal. You would have to stare very hard to see it's got a slight droop on one eye. And it was just by teaching the handlers as well how to do some very gentle trigger point massage
Mm.
along with the treatment that the sugar glider was receiving from the vet. You wouldn't know it had been ill. And yet its whole side of its face was all twisted last time I
Yeah.
seen it.
Have you ever been bitten by an exotic?
No, no, my handler has. I
Okay.
haven't. This is again, so I haven't done very much with snakes. We've played with the snakes to see what we can do and looked at opportunities for rehab exercises with snakes. I stand back, especially if he tells me something like, "Oh, this one hasn't been fed yet."
I
Um,
um I used to date a guy, a vet, who was a vet at the zoo, at the Johannesburg Zoo. And one day I went there just to like see what he was doing, and there was a big boa constrictor. It was huge, and it had a mouth infection. And so they needed about four people to hold it and to stop it from wrapping around anybody. And my boyfriend had to clean the mouth, and he had like a forceps with a cotton bud, and he was dipping it in like chlorhexidine. Somebody was holding the mouth open, and then he was debriding with this thing. And suddenly the guy let go, and the snake
got onto his hand basically and grabbed his hand. So now the snake has got his infected mouth over basically his whole hand, okay? And in that moment, everyone panics, let's go. One guy gets wrapped around. So now I'm not a big snake person at all. And I was actually filming this. So I'm now filming it, okay? So they wanted me to film what they were doing, for the zoo. And I'm like, I just put the camera down. I'm like, okay, like I'll help the guy at the other side, but sorry to my boyfriend, I'm not helping you. I don't know how to do that. So I'm like trying to now unwrap, and we're all trying to unwrap this snake around. Someone's trying to get the mouth off his hand. And we're trying to, and eventually we managed to do it. But it was very scary, I will say that. And I was like, "Phew, that could have ended really badly." And then, I mean, my boyfriend at the time, his hand, I mean, when they got it out, his hand was just bleeding everywhere. And I mean, he had to go on drips and everything, like IV antibiotics straight away. We took him straight to the hospital and, cleaned out the wounds and everything. So, yeah. I mean, I
Did
guess
the
we won't be
snake
treating cases like that, but maybe just now you get it like as a rehab therapist, like, a snake. And if you don't know how to handle snakes, I mean, all snakes can bite, right? How many snakes have you treated?
Well, this is it. So what we've done with the snakes is we've worked with them to see about what we could do for rehab, but I haven't had to treat any yet. A lot of the treatment is about husbandry, though. So we use something called a snake tree. So if you've got a snake that you want to encourage to do more movement, if you put them on a snake tree and then stroke them in the correct way, you can actually get them moving.
Yeah.
And by moving, you can help any dysfunction in the body, because what they will quite often do, because they're cold-blooded, is they will just curl up and go, we're not moving. The giant snake that I told you about, they've been teaching him to come to a tap. So outside his enclosure, they will tap on the floor and they will teach him to come to that tap, so they can teach him to move away from the door or to test that he's got good mobility. But as of yet, much as I might play with the snakes, I haven't actually had to treat any.
Yeah.
But we have looked at how their enclosure is. Have they got the ability to climb? Have they got the ability to go in water if that's what they choose? But going back to your snake story, this is where you really do need to foreplan. So I worked with a zoo with a chimpanzee who had very bad arthritis. And there is lots of things that you could do with a chimpanzee for arthritis, because obviously you're talking about a mammal and you're talking about something that's close to the humans. But what are you going to do when you can't remove that chimpanzee from its group? And also, it's not safe to go in there. Well, it turns out that the keepers had taught the chimpanzee to present certain parts of his body, and it was just something that they'd taught them over years because it's an important health method, or method of managing health. So we started looking at, well, what electrotherapies could we use that we can use the other side of the enclosure and still be effective. It may not be as effective, but it was a darn sight better than nothing. And sometimes you have to go outside the box to think about it. I, yeah, did they manage to sort out the snake's mouth? I have to ask.
Yeah, it came out, and they just carried on with the procedure. Somebody else just started doing it. So yeah, eventually it was fine. It sorted out, but it was a scary thing to happen, and just one that just makes you aware that things can happen very quickly. Listen, that was a huge, huge snake. So I mean, it's unlikely that one of any of us, so not to scare any of the listeners there about
Well,
treating
Rodney,
exotics, but I think
he
it is
would
important that we
he would
know
be
that,
on a par with that, Rodney,
yeah,
because he did, he came out one day when they were feeding him a rabbit, and it did take them three or four of them to get him back in again.
yeah. So how do you familiarize yourself with all the differences in anatomy of all the exotic species?
I am not embarrassed to say I love Google. So
Okay.
if I'm approached to treat, I am going to be very honest with the owners, the caregivers, and go, I've not done that one before. Let me just pull out my phone and let's start having a look. And let me have a conversation with you about what your knowledge is. Um, And is there anything that's specific that we need to know about this animal, this type of behavior, what it does, where does it live? Where is its natural environment? So one of the things that we've been working on, and kind of going back to pain scoring again, is what is that animal's normal behavior? Is it nocturnal? Does it live in a temperate climate? Does it live in an arid climate? Does it like water? And these are the things that we then look at to go, is this animal suffering? Is it in pain? So anatomy is part of it, but I think we have to look much bigger as what is the correct behavior for this animal in its natural environment, and how much of it can it exhibit to know whether there's a problem. So a nocturnal animal that's lying there sleeping all day is not unwell.
Yeah, exactly. So
So
we need
yes,
to
I'll
know.
Google.
Yeah, we need to know their behavior, which, like you say, there's just so many different. I know there are some really good exotic veterinary textbooks, which I think probably could give a lot of insights into all of that. But I'm not aware of any rehab textbooks specifically around exotics.
As I'm here, I haven't got it in front of me, but it's an exotics veterinary manual that's released every few years. I think the last one came out in 2022. And in there is one chapter which is 4 pages long. And in those 4 pages, it talks about rehab. And it actually has some references at the end. You're going to actually have the book, aren't you?
Well, this is actually a book that suddenly, as I was saying that, this animal osteopathy.
Oh, I don't know about that one. So the one
Never-
I'm talking about is
Yeah.
for veterinary exotics. It's not to do with rehab, but it does have a rehab chapter.
Okay. Yeah.
So there is a little bit out there where they've studied, 6 elephants, or they've studied a small group of turtles, and they have been written up. And what basically the text says is things like lasers, really good, therapeutic ultrasound, the pulse mag, exercise rehab have all been shown to be incredibly effective with a wide variety of species.
Yeah, as I was saying that, I was thinking actually, I suddenly remembered that I've got this textbook on my shelf. So this book of Tony Nevin's actually got quite a lot in here. There's all about small furries, there's reptiles, there is birds, and then there's actually some stuff on hedgehogs and quite a bit in here. So for those of you that are looking for something, and that's specifically on animal osteopathy. It's called Animal Osteopathy, a comprehensive guide to osteopathic treatments of animals and birds. So there's another resource if people are interested.
When we do the training, the CPD training, I think the two things we do is, one is understand what you don't know. That's
Yeah.
a huge part of it. Be willing to go away and learn about what you're being asked to see, because nobody would expect you to know how to treat the sugar glider compared to the boa constrictor compared to the water dragon, because they're all going to have slightly different requirements. And then be prepared that you've got to work very close with the vet, but be prepared to accept that you don't know the outcome, but you are possibly the last attempt to keep that animal alive. I have heard quoted that up to 80% of animals in collections that are put to sleep are due to musculoskeletal issues.
Yeah.
It's so
Sure.
common and so treatable.
Juniper, tell us about this course because it sounds like, for people that are not treating these exotics often, which is for a lot of us, it allows a therapist the ability to be able to handle some of these animals and just to get a little bit of experience and just to have some background. So should one of these exotics come through your door, you're a whole lot more prepared.
So in the UK, your professional indemnity insurance is what allows you to practice and be insured, and they don't routinely cover exotics. So part of the course is to allow for people who have attended the course to then go back to their professional indemnity insurance and say, "Can I now start treating exotics?" But you're right. What we do is we let people go in and handle these animals, have a go at some techniques. We do everything from rabbits and guinea pigs We've got a very amiable turkey that loves to have a bit of treatment on his arthritis on his feet, through to going into the reptile house and doing work with water dragons, geckos, the iguana, having a look at the snakes, because again, like I said, we haven't actually had to do very much with them. And also looking at the opportunities with some of the more unusual small mammals, where just feeding them a certain way might actually get them doing certain exercises you want to do, like stepping up on their back legs, and teaching people that they actually have a huge skill set, a massive amount of knowledge from working with dogs and cats and horses. All they have to do is just be brave enough to see how transferable their skills are. So you do not come away from the course becoming an expert in exotics. What you do is you come away hopefully with the confidence to go, okay, I'm happy to go away and research. I'm happy to talk to the experts in this species, but I could do this, this, and this. And if that doesn't work, I could try this instead.
Yeah, and I think just, giving you that feeling like I can do this, like you've got some knowledge in it. I've handled these animals, but I've handled different animals, and yeah, just making you a little bit more brave, I suppose, to be able to take on those cases. Chatting about the indemnity, I know just when we started our conversation before we went live, I was asking you whether pet owners actually insure their exotics or not, because it's not something common here in South Africa. So that's really an interesting conversation. Are these pet owners actually insuring them, and are insurance companies insuring them? But I know you said that some of the rabbits are insured in the UK.
So what we're getting now is, I think we have to look at how business models are, and the way that veterinary practices have been set up and run. We've now got some very big businesses running veterinary practices, and they are very good at working out what's going to be profitable. So we have had for quite a while things like the Healthy Dog and Healthy Cat Pet Club. So you pay your vet every month a set amount of money. It will include an examination, I think discounts on vaccinations, routine treatments, and maybe it includes your flea and worm treatments. So it's become very normal that people have pet insurance, but they also have this healthy pet cover. And what we're now seeing is more of these large veterinary practices, corporates, are offering healthy pet clubs for rabbits. It's very normal for people to have their rabbit vaccinated and neutered and microchipped. And those are all things we have seen develop within our pets, our dogs and cats. And it's now moving that way in exotics. So it's not there yet. And I'm sure you could get pet insurance for your exotic collection, but it is moving that way. So we're kind of about 20 to 40 years behind where we are with our dogs and cats. But owners really do care about their rabbit or their guinea pig, and they're taking it in for their health checks every year. So why shouldn't they be offered the opportunity of rehab or musculoskeletal therapies? Because that's what owners are expecting and hoping
Yeah,
for.
yeah, 100% agree. So, Juniper, if somebody was interested in finding out more information about your exotic course, where would they be able to find it?
If they head on to, or if they put into Google Bicton College, it will, and then search for exotics, they should be able to get details. Or they're very welcome to contact me. Because it's such a bespoke course, we kind of need enough interest to run it.
Okay.
So we had one recently where we had 6 really engaged students. It was only last week, and we'll happily run them again, because it's a way of getting that knowledge out there and making sure that there are more opportunities for people with exotics to get support and help. But in terms of whether we're going to transform the world or make a huge amount of money, that's not part of this. This is literally about trying to increase people's knowledge and skills so that they can share that knowledge. But we just need to have, 5 or 6 people that are interested, and we can run the course. But that's how it works.
Awesome. So for the listeners, I will get that link also from Juniper and just put that in the show notes. Juniper, it's been so lovely chatting to you. Thanks for all your stories of all your patients. And yeah, looking forward to following you and seeing what else you do in exotic rehab.
Thank you. And thank you for having me.
Take care. Bye-bye.
Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paul Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out, paulprosper.com. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of October, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com. And if you want access to our free membership, we update the webinars in this area every 3 months. You can sign up at onlinepethealth.com/free.